would be your discussion with them to try and maintain their mental health through the diagnosis and treatment phase?
Well, you already pointed to getting support in the form of some sort of professional therapy. But I would definitely be talking about, making sure even you have a trusted friend to check in with. And I mean, for me, even in general, one of my favorite things to do for myself, because the world can just be overwhelming, much less when you're dealing with a cancer diagnosis. It's going to sound silly, but it's the simplest thing. I sit down with a piece of paper and I write the word, "How are you, Julie?" ? And I let myself answer that question honestly. And it's a way for me to have a space to tune into how am I feeling. I think so many people don't, we're so busy running from one thing to the next, gathering information in situations like this, that we don't even really truly know how we're doing, other than maybe overwhelmed and maybe scared. But putting it down on a piece of paper and letting yourself, I mean, I'm amazed at what comes out of me when I actually sit down and do that practice and give myself a space, even if it's 3 minutes, to actually answer that question. And I go, whoa, I didn't realize I was this sad, or I didn't realize I was this mad, or I didn't realize, this, that, or the other. And doing that, one, can make me, just in the act of doing that, can make me feel like I've lifted a weight off of me because I put it somewhere. It's not just rolling around in my head, in the background playing and affecting me. I now put it on a sheet of paper. I got it off my chest, so to speak, and sometimes literally, right? I got it out of my body. So there are little tools like that, in addition to the support of other people, that we can do to support ourselves and to create. And this is for the caretaker too, not just the survivor. This is for any of us, where I have a space for me to check in with me and give myself time to breathe. I don't mean just literal breathing, although I do mean that, but time to let my feelings breathe and unravel and unfold on a piece of paper or in a piece of art that I scribble, even if I don't know what it means. So I'm really into tools to check in and ask myself, how am I? How do I feel right now? And I think that information that comes out of that can be relieving, but also informing about what I might need next. Like, wow, I really am angry. It almost feels too scary to answer this question alone. So let me get a therapist or a friend who can, hold the space with me while I do that. That's just one example.
Well, I think it's great. Well, guys are rarely introspective. So sometimes they have the emotional depth of a rock. And so they don't really do well. So they really do need, as you were alluding to, is a toolkit, a sense of tools, the ability, something that teaches them how they can kind of reach within. I sometimes think of when you fly on an airplane and they warn you, the flight attendants will say, if we lose cabin pressure, the oxygen masks are going to fall down, and you put one on your face first. And I'm thinking, God, that's selfish. No. But what they're right about is it's selfish. In other words, if you can't take care of yourself first, you're absolutely no help to anybody else.
Right.
And so this kind of is one of the important things. What I think you and Kathleen can address is the importance of, if men once diagnosed with prostate cancer, they have to be somewhat selfish. They have to kind of make sure that they take care of themselves, whether they use the toolkit that you're referring to, assistance through the journey, but they need to kind of line up all of the services and things around them. If it's your best friend or a spouse, you need to get those people around you lined up and really optimize everything around you so that journey can absolutely be the best it can be.
Can I add something?
Sure.
As you were talking about toolkits, one of my other favorites for me personally is to cry. That sometimes I just need to cry even if I'm not 100%, sometimes I'm crying about 100 things that I don't specifically know one thing. And when I'm done, I feel better. Not to mention that when I'm crying, I'm really in touch with how I'm feeling. There's no more guarding once I finally let my tears out. I'm in there. I'm with me. I'm in touch. And for me, both of these tools, the writing, "How are you, Julie?" ? And the crying are very spiritual to me. They put me in a space of presence. And that's going to mean different things to different people, but they get me to the real place. So I just wanted to add that, especially when you're talking about things like cancer diagnosis, that for me, tears are a release of tension and constriction in a situation where there's already enough of it. Yeah. So I just wanted, you said tool, and that, triggered my little brain. So I just wanted to add that.
Yeah. Well, for a lot of guys, we get this disbelief because when you're diagnosed with prostate cancer, you typically don't believe it because you don't see it, you don't feel it. It's not like something you might have on your face or your skin where you go, "Yep, there it is. I see it. It needs to go away." Right. And so it's really, first you have to convince people that, yes, you have this diagnosis. And although you don't see it, feel it, or know it, it's there. And you have to walk them through the process of how we're going to take care of it as a team and what is the team that you need to put together. Yeah. So it's really helpful.